Hi, my name is Megan Lycia RN, and this is my reflection video for CAM3 Phase 1. Insights I've gained about the role of the advanced professional nurse in population health, which comes from researching the American Association of Colleges of Nursing Advanced Level Domain 3 competencies. Advanced professional nurses play a vital role in population health by addressing specific health needs of communities and populations by analyzing primary data like interviews and surveys, and secondary data like the census or public records. Through knowledge and practice, these nurses gain the necessary skills to assess a population, determine whether there is a need or needs, develop and implement interventions, and evaluate the effectiveness of population health programs. The AACN Advanced Level Domain 3 competencies provide a framework for advanced practice nurses to develop these skills and the knowledge needed to become proficient in population health. Nurses can do this by using the framework to guide their practice, education, and research in population health. Additionally, the competencies can help nurses advocate for policies and programs that promote the health of their chosen population through collaboration with appropriate stakeholders and by assisting the RN in staying current on the latest evidence-based practices. As an advanced professional RN, I chose to focus on homelessness in Escondido, California. Using the Domain 3 advanced level framework, I developed a 5-step process to address this common but complicated issue. Step 1 assesses population health data by defining the target population and collecting and analyzing information on the health needs and priorities of this group. This could be done through surveys or interviews. This step also includes assessing this community's functional and problem-solving abilities to customize my approach. Step 2 focuses on developing collaborative partnerships with nonprofit organizations, public health entities, and other like-minded community members. Two valuable resources here in Escondido are Interfaith Community Services and 211 San Diego. Step 3 concentrates on implementing culturally competent care, which ensures that interventions are appropriate and sensitive to this population's diverse needs. These interventions would center on health promotion and illness prevention, such as giving out flu shots in the fall. Step 4 involves assessing policy and determining whether the ones in place are actually addressing the root causes of homelessness. Here in Southern California, we have a major problem with affordable housing and a lack of adequate mental health services. Either of those issues could be explored further. And finally, step 5 focuses on evaluating and analyzing outcomes and making necessary adjustments. A dedication to the spirit of inquiry and continuous improvement could make Escondido a better place for everyone to live. Thank you. I hope you enjoyed my presentation.